I think the next person to speak now, it would be Ian Mullen, who is a Health and Safety Officer for UNISON. Ian, please.
Thank you, Carmen. And I should probably clarify that I'm actually employed by the City of Edinburgh Council, but I'm seconded to UNISON. Thanks for everybody that spoke so far. It would be fair to say that Edinburgh Council were on the back foot, even although we had heard all the media coverage from Europe and the rest of Britain in the lead up to the lockdown in March last year. We were on the back foot because our corporate health and safety team, which was supposed to have 11 advisors, was actually down at 4, and these vacancies hadn't been filled. We didn't have a senior manager in post. We were actually managed by a consultant who thankfully agreed to stay on until recently during the COVID pandemic. Right away, it was obvious that the trade union reps that were in the front line were going to be absolutely vital. We started arranging alternative working arrangements in every department that was classed as an essential service, and that includes street cleaning and refuse collection and cleaning and home helps. And so right away there was a change in the working environment, and we were fully involved in that from the start. There was a lot of working groups set up, but unfortunately many of them didn't include trade union representatives, and especially myself being the senior officer in UNISON. The difficulties were obvious right away in health and social care. Within days, we were getting phone calls from colleagues from care homes saying that they were quickly running out of PPE. They were scared that they were going to be taking COVID home to their families and friends. We knew that people were coming out of hospital and were infected and going back into residential care. And, it was a really worrying time. There was a lack of information coming from the Scottish Government, because I was lucky in having a vice convener who was isolating at the time, and he was trawling through 30 to 50 briefing notes for the national government every day, and anything that was relevant to our services, he would pass to me, and then I would relocate that to either the health and safety team or the relevant department. And I was grateful for that. And we ended up having to actually write to one of the MSPs in relation to colleagues from the BAME community, because obviously they were 4 or 5 times more susceptible, along with underlying health conditions, to the virus. I remember speaking to one of our senior managers, and there was a briefing note for the national government on the Fenton report was being held back by the Tories at the time, and it was all about the infection rates within the BAME community. And the answer that I got was, it's only relevant to England and Wales, as if COVID had a border. So we ended up having to get that raised in the Scottish Parliament. In regards to home care, we had one worker whose client refused constantly to comply with the government guidance on social distancing and staying at home. And even although we asked for the client to stay at home, she refused, and we ended up using Section 44. With schools, 2 major issues with the government's guidance, fundamentally flawed. We were working all last summer with the operations team for a 25 to 30% return to schools, and then John Spinney says 100% return with 2 weeks to go, and we had to scrap everything and start again. And the recording of school infection rates, I think it was Rob that was saying that school kids have been back in Edinburgh, have been back to school in Edinburgh for the last 2 weeks, and we've recorded over 1,600 infections, positive cases in that time. And we are continuing to monitor both the community and the departmental positive cases, although overall the recording of cases in every department for the council has been indifferent, to say the least. Our corporate health and safety figures are just over 16 1,650, but already we've got 1,600 cases in schools, and that's only, so there is a problem within the recording system. Just, I know I'm just strapped for time, but one thing that I would like to say, how did our Edinburgh Joint Board thank our care home staff? By taking a decision 2 months ago that they were going to close 4 of our care homes. We have 65 care homes in Edinburgh. 9 of them are owned and run by the council, and a 5th one is going to be reallocated to the NHS. UNISON have got a petition on their website, the Edinburgh branch website. Please go into that and sign it. We also have our second rally outside the City Chambers coming up on the 14th of September at 9:30 in the morning. That's the second meeting of the IGIB. So if you are free that morning, please come along. Long COVID, the psychological effect of COVID in general is going to be a massive thing in the future. How we deal with that, the support that we give our colleagues, it's going to have to change. We obviously aren't going to go back to working in the same way that we did pre-COVID. There's no way. I mean, our chief executive is talking about doing a 25 to 30% return, and is 70% over the long term. So there are fundamental changes in the working environment, and there's also, we have to look at how people working from home are supported as well, because they're all doing long working hours,
To thank you for all the constant and hard work you've done during the pandemic, raising awareness and challenging employers about COVID-19 issues. I think your job has been amazing. So thank you very much. And I think it would be, I can see that someone has already put the details to join the campaign about stopping the closure of the care homes. I would appreciate, Ian, if you can put as well the details from the next rally in the chat so everybody can access them. Could you be able to, if you be able to do that, that would be great, Ian.
I will do. Thank you.
Okay, thank you. Thank you so much. Our next speaker is Sammie Mcfarland from Long COVID Kids. So Sammie, please.
Hi, thanks for having me. So I've been asked to talk about my personal experience, even though I'm the founder of Long COVID Kids. I'm going to start by just giving you a tiny bit of research, a tiny bit of information, which is that since children went back to school in Scotland, there have been 26,836 child COVID cases. We know from new research that up to 14% of children will get long COVID. So that is 3,757 kids who have got chronic and disabling symptoms since the start of term. My daughter got COVID in March 2020. She started off with a very mild temperature, almost nothing. She had a very insignificant cough, and she spent her time in her room in isolation, listening to music, watching Netflix, and not feeling particularly unwell. She came out of her room weak and tired after her period of isolation, and we thought that she was just weak and tired from having been in her room. Little did we know that nearly 5 weeks later, she would experience chronic heart pain. She would go pale, weak and floppy, and she would then be taken to her bed for the next 8 months. She spent 8 months unable to sit up, to eat, to shower, to toilet herself. She had to climb across the floor on her hands and knees to get to the bathroom. We couldn't leave her unattended in case she fell. My daughter was fit, a ballet dancer. She did paddleboarding, yoga trapeze, played with the dog. She had no pre-existing conditions that we're aware of. And then she had this time in bed that has caused her to lose her confidence, has affected her mental health. She's not been able to keep up with her education. And now, 18 months on, she's developing new symptoms. In the last month alone, she's been hospitalized twice by ambulance with blacking out, and they have no answers for us. My daughter has had a symptom list as long as your arm, which I'm sure people will roll their eyes at and say, how do we know that's long COVID? She didn't have these symptoms before she got COVID. She has heart palpitations, visual disturbances, chapped lips, sore throat, insomnia, headaches, back, neck pain, temperature dysregulation, so she can feel hot when other people are cold or cold when other people are hot. She has coughing, fainting, muscle weakness, loss of appetite. And for one period of her recovery, she had significant hunger and just ate and ate and ate. And nobody has any answers. There is no cure for long COVID, and it's difficult to access care. In England, we have 15 paediatric hubs recently established, 14 of which are open. We're waiting for one more to open. But the families from our support group are unable to access these clinics. There's no referral pathway that's being utilised. There's been little training for GPs in long COVID. And you can hear from the list of symptoms that I've just listed, it's difficult to diagnose. Until we have a clinical definition for long COVID, then children are going to continue to find it difficult to get help. As an organisation, we sent out freedom of information requests to all 32 local authorities in Scotland to ask what mitigation measures they had put in place. The answer, there is a huge disparity. We need urgent attention on robust mitigation measures in schools. The only way to prevent long COVID is to avoid COVID infection. I'm really here to talk about my daughter's experience, but I want to represent all of the families, the 3,750 families in our support group, many of whom are from Scotland, and I really feel like this needs more awareness. I'm really concerned about my daughter's ongoing ability to reach her potential. She's not yet back to being able to walk, play, socialise, attend school for full periods. Even now, 18 months in, she has only been back for the maximum of 4 hours. Thank you for having me.
Thank you so much, Sammie, for that. I would say, like, terrifying. I mean, as I'm talking as a mom here, it has to be a really terrifying experience. So I really thank you for sharing your experience here with us. So thank you very much, and for all the work your support group, your group is doing. Stacey McCann, that is for One Voice Support Group. Please, Stacey.
Good afternoon, not a problem. Thank you very much for giving me the opportunity to speak to you today. I am Stacey McCann, and I'm co-founder of the One Voice Support Group for clinically vulnerable and extremely vulnerable families. We're a grassroots group that was founded last year to support families who've been disregarded by our government. We do also work quite closely in collaboration with Parents United UK. So the government's insistence on sending vulnerable children into schools without any protection from COVID-19 is not only reckless, but it's grossly negligent and morally abhorrent as well. This is exposing vulnerable children, family members and education staff to a dangerous virus that's likely to cause them more lifelong health problems and in turn increased vulnerability. Our group members are scared, and many of them feel like they've been backed into a corner where they have to choose between their child's place in a school that they might have had a battle to get their child into, or their family's safety. And this is upsetting because it doesn't have to be like this. Personally, I'm clinically vulnerable. I have a clinically vulnerable child and a clinically extremely vulnerable child. And the pandemic for us has meant that my children have had to participate in activities on Zoom instead of in person. My boys play musical instruments, but they've never had an in-person lesson because of this. We can't freely see our family because we're shielding so carefully. For my boys to see their grandparents, we have to wait for my parents to isolate first. They wouldn't have to do this if the government had taken a strong suppression and elimination stance to begin with. They get excited just going on a car ride for an hour because it's something different. We are lucky to have a garden that they have access to play in, but not many people are as fortunate. COVID-19 is a huge risk to myself and the boys. If we were to catch this, it would definitely mean hospitalisation, severe illness, and most likely result in additional lifelong health problems or worse. Our biggest risk is that our 6-year-old would have a high chance of not surviving the infection if he were to catch it. I and my husband have sat helpless beside his hospital bed before more than one occasion due to his health problems. We don't ever want to have to do that again. The lack of protection for vulnerable people and the negative rhetoric that's been created around the word vulnerability has left a lot of people feeling worthless. Now, I know we have worth. Myself and my boys are worth a lot to my husband. And the reality is that if COVID-19 entered our household, he could actually be left alone without his wife and sons. This is why we've been shielding, why we continue to shield, and why we have to shield. Because if the government won't protect us, we have to protect ourselves. Now, this has made me even more determined to support organisations and to participate in events like this, because we need to make life safer for clinically vulnerable and extremely vulnerable children. And I want to help do that, not just for my family, but for other families too, for my niece, for our group and the families that have become our extended family, and for the families that I haven't even met. Now, I'm going to end with a quote, which is something a friend of mine said, and I know that she's here listening to this today as well. We are all just one severe illness away from becoming the next vulnerable person. And the people in government risking people's lives need to remember that. We are all just one severe illness away from becoming that next vulnerable person. Thank you very much for the opportunity to speak today.
Thank you very much, Stacey. It's another speech that has sent chills down my spine. Thank you very much. I think as Sally was pointing out, that other speakers have pointed out today, a lot of the suffering could have been avoided if proper measures. And so I hope for the events like these, people listen and learn from experiences, and we can put in place something better in the future if we have to face a situation like this. So thank you very much.